It's on. I'm just watching to see as people come in.
Is there anyone in here? Okay. Am I where you need me to be? Am I where you need me to be?
Yep.
And we're good to go?
Yep. We're just watching. There's some people coming in now.
Don't tell me when you want me to start.
We got
Hey
some
guys,
people.
happy Botox Day. So, we want to take today to kind of go through the most common questions we get as a practice regarding Botox. But before we jumped into questions, I figured it'd be good for those of you who have never had Botox, you can see how simple of a procedure it is. So we're going to inject Amanda quickly, and then we'll let her go, and then we can run through some questions. So you've been injected before, right? We've done stuff. Okay, so we did go a little before, but we're gonna do this and this time. Okay, so we've already kind of like discussed. Normally for new patients, you come in, we have a consult, figure out what's bothering you when you look in the mirror, and then agree on what areas we want to have treated. So we kind of already had that talk, and Amanda told me that she doesn't like, and she's looking great right now because she has had neurotoxin before, but previously, make that frowny face, she doesn't like these 11 lines, and that is the most common area we treat with Botox. And she also wants to do something fun called a lip flip, which will give a little bit more pink of the lip show without injecting fillers, because not everybody's ready for filler yet. So we're going to do upper lip also. We can also inject the upper lip for, she doesn't have any, but women that get the vertical lip lines, they really don't like those, and we can inject the upper lip to treat those also. So first, we're going to start with the glabella.
Gonna get up close and personal.
And some, like a lot of my patients come in on their lunch break, literally in between work. And at our practice, we use these little BD syringes to inject, and you can see how tiny the needle is. Oftentimes, I don't even have to remove makeup when we're doing Botox. Fillers are a different story. We want a real clean face for that. But just, you can essentially leave here not even knowing what you had done. Okay, so give me another frowny face. Okay, good girl, relax. 1, 2, 3, pitch. And we're going to go into units and areas and stuff once we're done with Amanda. Give me another. Good. Relax. But you can see I'm constantly having her, frown again, move her face so I can see exactly where she needs her injections. No one person always gets injected exactly the same. It can be dependent on your muscles, and you want to customize your treatment plans per patient because not everybody is made the same. Okay, lips tend to be the most sensitive area to inject, so let me get a little ice pack. All right.
It was super sensitive when I did mine, but it was so fast.
It is really fast. All right, give me a kissy face. Okay, good girl, relax. Pinch. Pinch. Okay, so you're like the best patient for me. All right, so that's it. Those were all the areas that bothered Amanda.
It was painless.
And we'll post a follow-up photo of her in a couple days when her Botox kicks in. So, thanks, dear.
Thank you.
How was it?
It was good.
Easy.
All right. All right.
Thanks, Amanda.
Bye. Thank you. Okay. So, Botox Day is officially the third Wednesday of every November. Well, this is the second annual year. So, on that day, Allergan offers great deals on gift cards. You buy $100 worth. You get $100 worth of gift cards for $50. So if you guys go to Allergan's website, take advantage of that today while it lasts. They will sell out. They sold out last year. So when you come into our practice, you'll hear me say Botox a lot. There's actually other neurotoxins on the market. There's 4 FDA approved ones. So of course, Botox is the star today, but there's also Dysport, Xeomin, and the newest one is Jeuveau. We have all of the products. We inject them all. But when we talk about, they're all neurotoxins or neuromodulators, meaning that they relax muscles in your face by disrupting the communication between your nerve and your muscle. Doesn't necessarily, people get worried, oh, my muscle's paralyzed, or they read weird things about Botox and get scared. All it does is stop the communication between your nerve and your muscle for, on average, 3 to 6 months. We'll come back to that. So, regardless of the product I'm injecting, I typically will say Botox because it's a household name like Kleenex. So here on out, when I'm saying Botox, it could be any of the neuromodulators. One of the most common questions we get is how do I know when I need to start my Botox? At what age do we start injecting Botox? And that is so dependent on the person. So it comes down to how gifted we are genetically and what we've done to ourselves with environmental exposures. So we're given what God gives us, okay, our genetics. And then the things we expose ourselves to in life will determine on at what pace we're aging. So tanning beds, laying out in the sun, smoking, bad diet habits, those are the types of things that will accelerate our aging. So I have some 18-year-olds that have laid in a tanning bed since they were 15 or so, and they need Botox now. But I have some 50-year-olds that have fewer wrinkles than I do because God gave them really good genes and they didn't abuse themselves. So there's a wide age range. When you're ready is when you have lines at rest that bother you. So not everybody's bothered by their lines, by their wrinkles. But when you look in the mirror and you can see creases in your skin, either across your forehead or these 11s here, crow's feet, and you're bothered by them, that's when it's time to start. There's been a big move about preventative Botox. When do we start doing preventative Botox? And if you don't have lines at rest yet, I don't think it's worth you investing in treating them. The longer you go without treating, once you do have lines at rest, then they're going to be harder and harder to fix. And an ounce of prevention is worth a pound of cure, because if we go decades of those lines being etched in, then that's when we're talking about having to use fillers and stuff to pop them back out. I like to think of skin like cardboard. So when you imagine that analogy, when you fold cardboard over and over and over again, and that line gets so deep, we're going to have to use a product beyond Botox, like a filler, to pop it out. But right when that cardboard starts to bend, if we catch that at that sweet spot and we start injecting a neurotoxin, that line never gets etched into place. So once you have lines at rest and you're bothered by them, that's when you need to start. And we say Botox lasts about 3 to 6 months on average. Typically, I would say 3 to 4 is most common. I have a handful of patients that they're fortunate enough to come in twice a year and their Botox lasts them that long. But there's not many of us that can get away with that. Most patients are on a 12-week rotation. A few of my patients that are, again, either gifted genetically with a high metabolism or work out a lot at the gym, you will burn through your Botox quicker. And some of them have to get injected every 8 to 12 weeks to stay on top of their Botox. So your metabolism will have a lot to do with how often you have to get injected. So keep that in mind. Next, let's go through the most common areas where we put Botox. And so the easiest way is to start at the top and work our way down. So forehead. I have patients all the time that come in and say, I need an eyebrow lift. Can you inject me up here and lift my brows? And when you know anatomy, your forehead muscle runs up and down like this. And it's the only muscle in our body that lifts our brows. So when we treat horizontal forehead lines, it will naturally lower your brow some. It's a yin and a yang. You have to have some give and take. So when patients come in thinking that we can inject forehead and lift their brow, that's not how it works. But a lot of patients have these horizontal lines and hate them, and we can sprinkle some Botox in a forehead and soften them. We normally do not treat a forehead unopposed without treating this area here, called your glabella, and that's the most common area we treat when you get those angry 11-looking lines. And so these muscles pull your face down, and by putting some Botox in these areas like we saw on Amanda, that will open your eyes and just make you look happier. A lot of times we have a scowl on our face and we don't even know it, and so Botox gives the appearance that we're a happier, nicer person when we treat this area. Moving down, crow's feet would probably be the third most common area, and these are our smile lines, and some people are completely happy with them because it means that we smile a lot and we're happy. But we can soften them without taking away your ability to smile. Obviously, nobody would want that. And then lots of patients come in wanting a lateral brow lift. That injection actually goes right out to the side of your eyebrow, not up here where a lot of times patients are pointing. And that can give you a little couple millimeters of lift in the lateral brow to make your eyes more open. Working down the face, this area here, we have a large muscle called a masseter, and if you clench down, you can feel yours. Some patients grind their teeth or chew gum a lot, and this muscle gets hypertrophied, and we can inject it with some Botox, 15 to 30 to 40 units per side. It's a very big muscle for your face to soften that. And what it will do is if patients have a real square jaw, it will narrow it and make it softer. And we use it a lot medicinally for patients that get grind their teeth at night and stuff. It makes a huge difference for them. We also inject on the sides of the nose sometimes. These little lines we can get, they're called bunny lines. And patients who really love their Botox, and we're Botoxing everywhere on their face, if we don't bring this up, sometimes this is the only thing that's really crinkling up, and it can be noticeable in conversation or whatnot. So, and some patients are just, I guess maybe we squint or something. These can be noticeable, so a couple units on each side of the nose will soften those lines. We also inject to the sides of the nostrils for something that's called a Gummy Smile. And you'll notice on Friends or whatnot, some patients when they smile, this muscle pulls their upper lip up so much that you have a lot of gum showing. And some patients don't mind that. That's kind of their signature smile, and some patients are really bothered by that. So by injecting just a couple units on each side, it'll drop the upper lip, and you won't see as much gum showing above their teeth when they smile. We also inject right above the pink of the lip, like we did on Amanda, for either a lip flip or to soften vertical lip lines. And we inject the chin quite often. You don't see it when you're looking in a mirror at yourself so much, but when you talk or are communicating, sometimes your chin will get a dimply appearance, and a little bit of Botox into your chin will really soften it to create that dimpling or to stop that dimpling of your chin. Now working down, we also inject along the jawline sometimes for what's called a Nefertiti neck lift. And the muscles, every muscle in your face is like a give and a take. Some is pulling and some are pushing. So by injecting along the jawline here, it stops the pulling of the muscle. And so this ends up looking tighter at the jawline. And then of course we all have these Platysmal bands, these bands in our neck that stick out. And some patients are really bothered by them. Some folks it's really noticeable on. And we can inject those to soften those lines. It just softens this muscle so those bands aren't as noticeable. And then some patients have horizontal lines in the neck. A little bit of micro Botox in the neck will help with those horizontal lines. That's pretty much everywhere offhand I can think of. We use cosmetic Botox. We also use Botox in dermatology for hyperhidrosis, which is excessive sweating. So under the arms, in the palms, or on the soles, we inject Botox to decrease the amount patients sweat. Other specialties use Botox all over the body. Urologists use Botox to inject into spastic bladders. Neurology uses it for spastic muscles. We inject very young children with hundreds and hundreds of units, not we, neurology, hundreds and hundreds of units for spastic muscles. So when patients come in, they're like, oh, I don't know, I mean, I want these lines fixed, but I don't want Botox because, you know, I could get botulism. That's not the way it works. Botulinum toxin is from the bacteria Clostridium botulinum, but you don't get botulism by injecting Botox. You get botulism by getting infected with that bacteria. So I have to explain to patients, like, we use way more Botox than what we're going to put in your face into young children to help with various different things. ENT injects Botox into vocal cords to help with spasticity of those. So we use it all over the body, and the side effect profile is really, really safe if you're going to a skilled injector that is experienced in injecting it. What else did I want to tell you guys? Some patients, when you come in and we're talking cosmetic lingo and we're talking about, oh, you need 20 units of Botox, or you need 2 syringes of Juvederm or Restylane. Some patients are like, okay, but I don't even know what you're saying. Why is 1 in units? Why is 1 in syringes? And we don't talk about units per se with fillers because they pretty much all come as a 1 cc syringe. A few of them are 1.5 or something, but fillers are injected per syringe. Botox we can customize. You don't need, say, a whole syringe of Botox, and that wouldn't even be relative. Like, each practice may inject a little bit differently. You know, some might have a 0.3 cc syringe, some may use a 1 cc syringe. So it'd be hard to talk about Botox and syringes. So when you hear us saying units or area, some practices will sell Botox in areas, like a forehead for $200 or whatnot. Crow's feet are going to cost you a certain amount. I personally prefer to deal with units only because it's more customized to that patient. Not one patient might only need 6 units in their forehead, and, you know, paying $200 to treat a forehead, you would be overpaying for what you personally need. So I like to deal with units, but there's no only one right way to do this. So that's the way it is here. So when we talk about units, we're talking about Botox or other neurotoxin, and we're talking syringes, we're talking about fillers. Any other questions? Min?
People are saying hi. Lots of highs.
Oh, does it hurt? That's sometimes I get.
Mm-hmm.
You guys saw how tiny these little BD needles are. That's a pinch, and it's really fast. I've never had a patient not come back to get more Botox because of pain, like, ever.
Yeah. I'm terrified of needles, and it didn't even faze me.
Some patients are like, okay, what's the worst thing that could happen, or what should I expect? Sometimes, if you're a bleeder, you can get a little pinpoint bruise where we inject you. That's not unheard of, but it's not common because these are a little tiny gauge needle. You can, if you're not going to a skilled injector, you can sometimes get a drop brow or a heavy eyelid. That's typically the worst that's going to happen. The beauty is it wears off in 3 months, but it is a bit annoying walking around with a heavy brow or a dropped eyelid. So go to somebody that knows what they're doing, that does this every day, and it's a really safe product. If somebody knows. Yes.
So we have a question. Alva would like to know, why do some people not get long-lasting results? She had Botox at a different place, and she felt like it really only lasted about 2 months. She said she's a bariatric patient and has quite a bit of loose skin anyways. Could that be why she's not seeing the results she's looking for?
If, Alva, you are investing a lot of time to try to continue to lose weight, so the rate, it could be that you're being very active and your metabolism has kicked into high gear. So the biggest determinant of what wears your Botox off quickest is metabolism. And some folks, for whatever reason, they are like a 8 to 10 weeker. I would recommend, if you if you've seen that, if that's been replicated more than once with Botox, we're talking brand Botox now, try one of the other neurotoxins. You know, I have patients that if they're like, my Botox doesn't last that long, we'll try Dysport, for example, and see how they do. And a lot of times they get 3-4 months out of their Dysport. So don't give up on it. If you've been injected a couple times and you feel like it's wearing off, then ask your injector, see if you can switch to a different product. Because oftentimes it's not across the board on neurotoxin. It could be that specific brand.
And someone wanted to know how much it costs, which I know is...
That's actually a great question, because patients always over the phone want to know, well, how much do I need to bring? What can I expect to pay? So it all depends on how many areas we're treating, how strong your muscles are, and how etched in your lines are already. Generally, you know, like a forehead, somebody might need a sprinkle from 3 units to 15 units on a forehead. And typically, you're looking at $10 to $12 a unit, you know, so your cost is going to be dependent on how many units you need to create the result that we want, that we're happy with. So like I was saying, it all depends. A forehead could be 3 to 15 units. Somebody's crow's feet could be 4 to 15, 16 units. This area between your eyes, on average, you know, is 20 units, but I have some patients, they get like 12 here, and I have some males that get 40. So it's a wide range, and we always recommend patients come in. You can have a free consult. We'll sit down, go over your goals, what we give as realistic expectations, how we can get there. We talk about our budgets and what we can accomplish with the amount of money we have to spend. And it's free to do that. You can text Tawny Tawny's my cosmetic coordinator. She is a lifesaver, and she deals with all of these texts and emails. And her number is 462-4662. Area code 352. 352-462-4662. So shoot Tawny a text and say, hey, Tawny, I'm interested in whatever. And she'll get in touch with you that day, and we can line something up. What else?
Marianne would like to know, how soon will you see good results?
Oh, great question, Marianne. So yeah, a lot of times patients are confused, thinking they're going to leave the office looking refreshed right away. So all the neurotoxins take anywhere from 3 to 14 days to kick in. Most of them are around 1 week or so. So once you get injected, you leave here looking exactly like you did when you walked in. And then over the next week, when you're looking in the mirror and you're trying to scowl or trying to raise your eyebrows or trying to recreate crow's feet, you'll notice that your muscle is not moving, it's not tensing as aggressively as it was. And the longer we weaken that muscle, so even a month into your Botox, 2 months into your Botox, that line will look less and less noticeable because we're not bending that cardboard anymore. And then you'll notice over 10 to 12 weeks on average, your Botox starts to wear off some. And you're in the mirror and you're like, oh, I can see those lines again. That's when it's time for you to come get your touch-up, because you don't want to wait until you're fully moving again and etching in those lines. We're starting back at ground zero. That's why quarterly seems to work out for a majority of patients.
So if would you get less units the next time you came? Potentially.
Not necessarily the next visit. Patients that have been getting injected for a decade or many years, we find that your muscle kind of starts to cooperate, and it doesn't take as many units to weaken it as it did initially. So over time, patients have found that they can either stretch their Botox longer. If they were a 3-monther, they go to 4 months, or if they always had 20 units in their glabella, now maybe we get away with 15 units over time. That normally takes years to happen, not treatment to treatment.
Okay. And Alva wants to know if we do injectables at Jasmine.
Yes, I'm so excited. So I have a new colleague, Dr. K, is out at our Jasmine Park office, and she is fabulous. And so now we can offer patients on the southwest side of town. You don't have to drive over here to the southeast side of town. Dr. K's over there, and she's great at injecting neurotoxin and filler. So she actually injected me a couple weeks ago.
We have a question. What about turkey neck? Are there any treatments?
Turkey neck, that's the vein of all of our patients. Honestly, if it's a true turkey neck, then you're a surgical candidate. That little neck lift I was talking about is best for tightening jaw lines. It's not really going to give you the you're not going to have the result that you want with Botox, okay? There are some energy devices, lasers and stuff that can tighten some skin, but if you're in the mirror like my mom and you're going like this, then you're a surgical candidate, unfortunately. Botox isn't going to be able to tackle that.
Okay.
There was another question that I thought of while I was talking.
I think we answered everything on here so far.
How are the time?
Oh, she said thank you.
You're welcome.
We are right about 20 minutes.
Okay, so if you guys don't have any other questions, we'll sign off. And you can always, ask at any point. We'll post some social media updates and stuff as questions come in and answer them later.
Yeah. Alva said thank you. It was wonderful, and she's going to make an appointment.
Can't wait. All right, bye guys. Have a great day.